All right, good morning, everybody, and welcome back to LouVax. The team here is just continuing to do an outstanding job accommodating the makeup appointments necessary to get caught up after the closures last week from the snowstorm. It's hard to believe that was all a week ago, but that's all we were talking about all the time. But here we are with different weather, so welcome to the Ohio Valley. This LouVax site continues to be recognized as one of the most efficient operations in the whole country, so we're just really proud of our public health team and all the volunteers that have made that happen in our entire medical community. We're just doing wonderful work as a team here to fight this dastardly virus. This is a week of mixed feelings. As a nation, tragic milestone of 500,000 people, 500,000 people passed from COVID-19 this past week. And it's hard to put your head around that, especially when we think back about a year ago. You know, we were hearing about the virus, but little did we know how much tragedy it would leave in its wake. And the magnitude of these losses really is hard to process behind each and every one of them. Everybody knows somebody that's been affected by COVID right now. But just the emotion and the sadness is really, really tough. So it's why we want to keep doing our job. If you can't get a vaccine, wear a mask, right? Everybody can wear a mask, and wear a mask even after you get the vaccine. So that's the sad part. As a community here too, we will be approaching, I'm sorry to say, 1,000 deaths in the next several weeks. So that's a bad milestone for us as well here. With that backdrop, of course, it's a really hopeful time. Vaccine supplies are increasing, and they're going to keep increasing in a very significant way. So there's lots of hope around that. There's lots of hope for a lot of parents, too, and many students with yesterday JCPS passing their go back to school vote, the JCPS board, in a limited way, but a lot of people are very fired up about that. So that's another reason for hope. Cases are falling. We're glad to see that, because for months they just kept going up, and now for over a month they've been going down in a very significant way. But we can't let our guard down. We can't let our mask down yet, because we got a long way to go. But we do have real reason for hope and optimism that the next 12 months are going to be very different and much brighter than the last 12 months. And obviously these life-saving vaccines are a big reason why. I do know that there are still some people in our community who still feel some hesitation about getting that vaccine. That's not so much of an issue right now when demand exceeds supply, but in probably 6 weeks or so, 6 to 8 weeks, supply is going to increase demand. So that's when we really have got to be already have addressed the people that are vaccine hesitant or vaccine skeptical. I want to make sure that everybody understands that this vaccine is safe. The testing process involved 70,000 people. More than 45 million people in our country alone have received the vaccine to date, and over 110,000 in our city. I've received it. You might have a little sore arm. Your legs might be a little shaky after the second dose, but it's nothing that an aspirin and a good night's sleep doesn't take care of for most people. And believe me, it's much better to have those symptoms than it is to get COVID. So by taking the vaccine, and with all of us working together at LouVax and throughout our hospital system and pharmacies and clinics, we're getting closer to herd immunity. That's really our goal here as a city and a state and as a country, because then maybe we'll be able to take our mask off and hug our friends and our parents and go to your favorite restaurant, go to a favorite concert, whatever it is, but people keep just wanting to say, man, it's going to be great when we can get back to normal. So this is a big part of making that happen. Now, another big step, as the governor has announced, starting next week, March the 1st, we're going to open up appointments for vaccinations to people 60 and over. So a lot of folks have been asking about that, so that's a big milestone that beginning on Monday, individuals 60 and older can begin scheduling their appointments to get vaccinated through our various vaccine providers. So this is outstanding news for the community. We want to get as many shots in as many arms as quickly and efficiently as we can. Now, here to give us more information on the next stage of vaccinations, let's welcome our Associate Medical Director and Co-Chair of our Vaccine Distribution Task Force, Dr. Sarah Beth Hartlich. Dr. Hartlich.
Thank you, Mayor. As you mentioned, we've made tremendous progress toward vaccinating our community. Together, we have completed Phase 1A of healthcare workers and long-term care facilities and gone a long way toward completing Phase 1B, which includes first responders, educators, and all adults over the age of 70. The wait list for appointments for those over the age of 70 is nearing its completion, which is to say that everyone has been offered an appointment. I'm proud to say that we are now ready to make the next step and move into Phase 1C. This is potentially a very large group measured in hundreds of thousands rather than tens. And while our vaccine supply is increasing and we expect it to continue to do so, the vaccine remains a precious resource. The Vaccine Distribution Task Force has, in communication with our cohorts at the state level, decided to place an emphasis within Phase 1C on adults over the age of 60. This decision in no way is intended to diminish the contributions of our essential workforce or the very real need to vaccinate patients with underlying medical conditions. These groups are very important, and we will seek to include them as quickly as we can based on supply. But we know from experience that the greatest burden of severe disease, hospitalization, and death occurs in the group of adults over the age of 60. We expect that placing this emphasis will really save many lives. Beginning on Monday, March the 1st, any adult over the age of 60 will be eligible to schedule an appointment for a COVID vaccine with a local provider. Please remember that the schedule is and likely will remain very full. Your appointment may be a few weeks from now. You may spend some time on a wait list. We ask for your patience as we are committed to delivering vaccines as quickly as the supply allows. Thank you.
Thank you, Alexis. We've got a big group behind us here today, and they are members of our Vaccine Distribution Task Force. So we started this bill probably 6 or 7 weeks ago. This is Bill Altman back here. Bill is the co-chair of the task force along with Dr. Hartlich. We wanted to bring all of the members of our community together from our scientific community, our business community, and our healthcare community so that we could all figure out together how can we defeat this virus as quickly as possible. This group kind of was an extension of our testing task force as well. And I can tell you, in talking to other mayors around the country, one of our secret weapons in terms of defeating the virus is the teamwork of this outstanding group we have behind us here. Sometimes, you have competitors. You'd say this hospital system might be a competitor with another hospital system or this business or that business. None of that has really manifested itself in both our testing and our vaccine processes as well. So you'll be hearing from a few of them in a moment. They're available to the media as well afterwards if you all want to speak with any of them. Dr. John Klein is here. Dr. Klein, of course, is famous because he is the doctor in the weekly The Doctor is In program. So, Dr. Klein, it's so good to see you in person. Thank you for being with us here today. Let's hear it for Dr. John Klein. All right, I'll pay for that later. Okay, so LouVax, outstanding partnership with the state and federal government, because remember, that's how we're getting the vaccines, right? Federal goes to state, state comes down to the local level, and then we've got to work with our community partners, pharmacies, clinics, and local hospital systems to get this done. So we're working with them to set up multiple avenues for people over 60 to make their vaccination appointments. This has been a long-held desire to get people over 60. So we have 9 options for making an appointment. So to tell us more about how these will work and about their own vaccination efforts, I'm going to welcome several of our community partners that are members of our vaccine task force. So first up is Dr. Chuck Anderson, Vice President and Chief Medical Officer of Baptist Health. Chuck?
Thanks, everyone. Thanks for being here. Thanks for asking us. Yes, we've been very happy working with all the other hospital systems in the city. We are opening up our website, scheduleyourvaccine.com next week on the 1st, also Monday, and we'll be expanding. Happy to announce that we're opening our drive-through today, and that will be expanding next week as well. So that's our main effort right now, is expanding from the website and getting more vaccines to get them into more arms. So thank you.
Uofl Health, of course, is a really integral partner with these efforts. Dr. Jason Smith, their Chief Medical Officer, is with us here today, and he's been at the front of a lot of our conversations here on this virus for a long time. So, Dr. Jason Smith.
Thank you all. So Uofl Health is going to continue our efforts as far as the vaccination is concerned. We are going to start opening up the majority of our appointments on Thursday mornings for the new 60 and over group. We'll have them out by about 8 a.m. on Thursdays for the upcoming week, as well as continuing to have kind of a rolling appointments as things open up. We are going to continue to work with our church partnerships throughout the community to help bring some of the vaccine into the other areas and neighborhoods within the community. We will be at First Gethsemane Church this weekend, and we're going to continue to work with Emmanuel Baptist Church, as well as many of the other churches moving forward in the upcoming weeks. That effort will continue. If you need to get into our appointments, we will have appointments at South. We're going to have appointments at our Brook and Liberty location, which is drive-through. We will also have appointments at Mary and Elizabeth, and if you're out in Shelby County, we'll have some at Shelbyville Hospital beginning next week. You can get on those appointments by getting on uoflhealth.org. If you would like to be one of our community partners, please, you can get on uoflhealth.org as well, and there will be a list and a sign up to ask if you'd want to be part of our partnership to get out into the communities from the church standpoint. And I want to thank all of those partners for letting us use some of their multi-use facilities to help set up some of our vaccine drives and vaccine events that we've been doing. It's been a great outreach for us, and it's been a lot of smiles and happiness throughout the community being able to do that. So thank you.
Thank you, Dr. Smith. And of course, he alluded to Uofl Health going into the community. We're getting really outstanding results working with some of our community partners, and particularly some of our black churches. And we're just finding we've got to reach out in many different ways. So where are people most comfortable receiving the vaccine? So the equitable distribution of this vaccine is really important to us. Black and brown communities have borne a disproportionate pain from healthcare in the past, so we're determined to make sure that they're getting vaccinated at proportionate levels. So going into the community right now is a big part of that. That's going to change a lot when supply comes on. It's going to not be that uncommon for that to be taking place, but I'm very appreciative and thankful of our healthcare partners, our hospital systems, for moving into the community and partnering with so many of our organizations. Norton Healthcare Systems has been a big part of that as well, that effort, and of course vaccinating at all of their locations. So next I'd like to welcome Dr. Steve Hester, Chief Medical Officer of Norton Healthcare. Steve?
Thank you, Mayor. Really excited to be here today, especially considering Dr. Hartlich had mentioned that the 60-plus age group was certainly feeling the effects of this pandemic horribly for the past year. So it's great to move into this category. We'll be providing, we've been continuing to provide the vaccine in the community. We have 4 fixed locations spread across the community. As Dr. Smith had said, we're working with churches, going into the community and trying to have special events that allow us to definitely spread the access. And for those who are having more challenges getting the vaccine, bring it to them. Nationally, if you look, there's a lot of comment lately that their supply will continue to increase. While it's a little bit still restricted, we hope to see that increase in the upcoming months. What we'll be doing for scheduling is on our public website, we're having a wait list, basically having individuals go to that list and creating a queue. As individuals put their name on that list and spots become available, we'll send them back an individualized link that will allow them to schedule appointments. People are in the queue as they've gone through, so what that allows us to do is to continue to build that. We expect to be adding appointments over the next month, and then certainly as increased supply becomes available, we'll do the same. So really excited about this as well, working with LUVAX. As appointments at LUVAX become available and they have capacity, we'll also be sharing some of that list as we did with the 70+. So some patients who go onto that list may find themselves getting a link to come to LUVAX for that appointment. The goal is to get everyone vaccinated as quickly as possible. So thanks for sharing the message and appreciate your help.
Okay, and our federally qualified healthcare centers, or FQHCs, are a big part of our vaccination efforts as well. So to speak on their behalf, Ann and then Bill Wagner are going to be coming up from our FQHCs in the community. Come on up.
Good morning, and thank you, Mayor. With me this morning, I've asked Ann Hagan-Grigsby, who's the CEO at Park Duval Community Health Center, to join me. Currently, the federally qualified health centers in Louisville have 4 vaccination sites. The family health centers have 3 sites at our Portland, Fairdale, and East Broadway location. Park Duval is providing vaccine at their main site on Wilson Avenue in the Park Duval neighborhood. Each year, our health centers provide care to about 10,000 persons that are age 60 and older, and a majority are racial and ethnic minorities. Our patients live in medically underserved neighborhoods where the residents are most at risk for COVID transmissions and most at risk of dying from the virus. And our primary goal is to ensure that the most vulnerable in our communities have equal access to the vaccine, as the mayor has indicated. Because of the limited supply of vaccine to our health centers at the present time, we will focus on serving our patients first in the regular health centers that they're familiar with, where they go for their regular medical care. We will not have online scheduling portals that you've heard described by the hospital systems, but rather we will reach out to our patients to call them by telephone to help them schedule an appointment. If someone is a current patient at any of our health centers and they're 60 years of older, they can also call their health center and we'll help them make an appointment. If we don't have appointment slots available, we also have partnerships with Uofl Health and Norton Healthcare, and soon to be with Baptist, where they can help our patients obtain appointments at their sites. So we're committed to making vaccine more accessible to everyone, especially those that are most risk in our community. And as more vaccine becomes available, we will be opening up more of our sites to vaccine clinics and to opening up our sites to the general public. So thank you very much. Thank you.
Okay, to close us out will be Bill Altman. As I mentioned, Bill is the co-chair of the Vaccine Distribution Task Force, and he's going to give a description of kind of what the task force does and how we're not only dealing with the issues of today, but the issues as we look down the road as well. Bill, you and the team are doing a great job. Thanks very much.
Thanks, Mayor. And I just want to start by thanking all the members of the task force who spend all of their time working to bring vaccinations to the community. Basically, the task force is comprised of a combination of healthcare providers, many of whom you've heard of from today, to who are in a position to bring vaccines to the community, medical experts, science advisors, employer groups represented at the table because that's a really important partner in our vaccination efforts, community health centers, and others. And basically, we meet every week and figure out how we are going to bring vaccines to the community in an efficient way and in an equitable way. So we look at the data, we look at distribution mechanisms, we look at the supply coming from the state, and spend our time figuring out how we're going to efficiently bring vaccines to the community. So, you know, we'll continue doing that. As the mayor said and others have indicated, we expect vaccine supply to increase in the coming weeks. So it's our job to make sure that we have the capacity to deliver whatever vaccines come our way. And that's the essential focus of the task force. So we look forward to the supply increasing and focusing our efforts on bringing those vaccines to the community. Thank you.
Thank you, Bill. And we're also, the communications subgroup as well, of course, is important all the time, but it's really important right now to make sure we're getting the right messages to groups that might be a little vaccine skeptical or vaccine hesitant, to make sure they get the information so when it's their turn to get the shot, they will feel comfortable about doing so. All right? So I think my third final speaker, I think I've said I've had final speaker here twice, is Dr. Hartlich is going to come back to the podium and share some information about the new appointment system we have and the latest data on our vaccination totals here at LUVAX. Dr. Hartlich.
So LUVAX will be focusing on the 60-plus group along with our other providers. We will be offering appointments from off of Norton's waitlist. We've developed a good partnership with them along the 70-plus group and expect to continue that as well. I'm going to close by delivering our weekly data update. So for through close of business yesterday on Thursday, across the metro area, we have delivered a total of 167,973 COVID vaccines. That includes 110,789 primaries or first doses and 57,091 boosters or second doses. So approximately 18% of our community has received their first dose and approximately 9% has received both. Here at LUVAX, our total number is 40,911 with 27,849 primaries, 13,062 boosters. We also like to recognize our volunteers during this period every week. As of today, we have 6,120 registered volunteers who have given a total of 39,590 hours on site. And I hope the volunteers behind me can hear me when I say that I think their labor is priceless, but there is a multiplier that is used for these things. And this week, the economic impact of our volunteer labor crossed the $1 million mark and is now $1,076,848. As you know, after our volunteers serve 40 hours on site with us, they become eligible for vaccination, and to date, we have vaccinated 523 of our volunteers. Choosing volunteers of the week is a challenge every week because they are all fantastic, but I do have a few here with me today. First, I have Sobia Farouk, who's been here and been an extremely flexible volunteer who's worked in all 3 of our zones and been willing to take on any job that's been asked of her. Thank you, Sobia. I have Allison Solon, who always signs up to work the first shift in the morning and then doesn't go home and stays here until the end of the day. She works in the pharmacy station where she's given us over 100 of her hours. Most of our volunteers are here to serve the public and to take care of patients, but it takes a very special volunteer to care for other volunteers. So those who work in the volunteer reception area are among our most popular folks. And representing them today, I have Pedro Valente. I have 2 more who are not here with me today, but I'm going to share anyway. Megan Shelter and Laura Bone, whose supervisor in Zone 3 stated that they have, this is a direct quote, a high degree of dislike for cold weather, but a high degree of joy that makes it fun to work even when the weather is bad. And then we also can't function without the service of a large number of Metro employees. We have about 40 on site with us here every day. Many of them are here on a rotational basis. They come and go, and this one is rotating back to her quote-unquote real job next week, so we'll be sad to see her. Hope she comes back someday. But Tony Rice has helped us implement a number of new innovations here at LUVAX. Whenever anyone has had an idea, can we try this? We try something out on the floor, and Tony has been the person to track the metrics to see if it was actually a good idea or not. So thanks to Tony Rice for her service. And that's all I have for this week. Thank you.
Thank you. I want to just again commend everybody here and also call out our nurses that we celebrate every week. Delnor Manson, the president of the Nurses Association, with you. Thank you for inspiring so many of your team. They're always showing up and helping out here. Really appreciate the good work that you do. And your colleague, Dr. Ruth Carrico, over here, who's helping in so many ways as well. So let's give it up for our nurses and everything that they're doing for us. All right. With that, we're happy to take any questions.
Mayor, I wondered how many people over 70 are still waiting and how you all are going to make sure you take care of them as you get a flood of requests from people 60 already.
Yeah, so the question is, how many people do we estimate over 70 are remaining, and how will we take care of them? I don't know, Doc, if you have, they will always have priority as we get into the other phases.
They continue to be eligible. Everyone who was on the wait list has been offered an appointment. I'm not sure, a couple weeks out. We're scheduling a couple weeks out into the future, so they may not have actually gotten their vaccine yet, but they should at least be on a schedule somewhere if they have gotten on the list. But just because we're moving to 60 on Monday doesn't mean that 70 is not still eligible to jump in there as well.
Will they go to the top of the list whenever they come in?
Yeah, and they continue to have priority on the list, just the same way that we've held some amount for healthcare workers along the way. Yeah. So the question is about the Jansen vaccine, which we expect to see approval from the FDA under EUA today. That, as you may know, is a single-shot vaccine. It also has much less stringent handling requirements. It's a lot less delicate than these mRNA vaccines. And so we are very excited to be able to hopefully deploy that into the community in, for example, transient housing, hopefully into our homeless communities, things like that. I expect to see the health department receive some of the Janssen vaccine, and that we will be deploying that into the community. Those conversations are ongoing to determine the quantity, but we expect to receive some hopefully before the end of March. So the question is about essential workers, and you're exactly right that it is a very large group. It sort of depends on how you define them and which way you slice it, but we have an employer subgroup on the vaccine distribution task force, and in communication with them as well as the task force at large. There will have to be some kind of organization to get through those people in an efficient manner. We look forward to partnering with some of our large employers to get their staffs vaccinated, but that is not yet clear what that prioritization will be. We estimate that there are at least 100,000 people in the 60-plus group, and so I would expect it, based on our current supply, that it would take us at least 5 to 6 weeks to move through that. Hopefully we can exceed that estimate. We've exceeded every other estimate so far in this project, but I think it would be reasonable to guess at least a month to be able to get through that group.
All right, I also want to recognize Dr. Sarah Moyer over here. Of course, she's the Director of the Public Health and Wellness Department and our Chief Health Strategist, so you all are very familiar with Dr. Moyer. Thank you. Okay, so we're kind of in a changing landscape right now, as we've seen. There's, the tragic milestone of 500,000 passed in our country versus the hope of the vaccine, and then a lot more vaccine coming. And then a lot more vaccine that's going to be more flexible with its storage capacity, specifically the Janssen vaccine, and maybe some other progress as well. Steve, is that right? Do you want to comment on that?
Come with the Janssen vaccine?
No, with the lower storage, freezer storage.
Oh, sure. So I think one of the things the mayor was referring to was it does look like the FDA did make some recommendations on changing the Pfizer storage recommendations, which were ultra cold freezers. It would allow it to be stored in normal freezers, which does allow some changes in terms of how you process that, as well as how you get it out in the community. So I think it may offer some opportunity for us. Certainly we're waiting on to see those full recommendations, but I think as a community it'll allow us to look at using some different sites, and certainly as we've been going into churches, potentially using that vaccine in those facilities as well.
Thank you.